we're going to talk here about the School-Based Telepractice Assessment. I'll call it the STA, Part 2. And this is something that Erin and I wrote together. So let's see, there's, George more than kindly reviewed my presenter information, but just to tell you what I'm doing now, I'm living on the Long Branch, New Jersey shore of New Jersey. I'm keeping my dad company. He'll be 98 on Sunday. And I'm doing a lot of remote teaching and journal editing and writing and stuff like that. So I'm working at home like many of you are. And if you need to contact me for any reason, there's my phone number, there's my email. I will respond quickly if I don't, assume there was some glitch going on. Okay, so now in terms of your learning objectives, I'll be describing the STA. I'm really going to be interested in talking about if services that are delivered by telepractice are comparable to those delivered in person. I have more questions for you than answers about that. But at the end of this, you should be able to describe an obligatory requirement and then describe what you think is an optional requirement. And then you should be able to list 3 categories of the STA's telepractice assessment. So conflict of interest, speaking fees, book royalties, university salaries, those are financial relationships. My non-financial relationships, American Telemedicine Association, I'm a member and a past board member, the only rehab person on the board, I think, ever. I was the founder of the special interest group from ASHA for Telepractice, Group 18. It's a great place to meet colleagues. I work on the Mid-Atlantic Telehealth Resource Center on their annual conference. There are many different regional divisions of this, and it's great. I really advise you to look for that and think about paying attention to your region. And I edit the International Journal of Telerehabilitation. I've done it since 2008, and my gosh, the number of submissions are just exponentially increasing. It's amazing how much time it is and how much I depend on reviewers. If any of you want to be a reviewer, let me know. So let me introduce you now to the STA. Now here's a download of the STA, and why I did this was you don't have to download it now. There's enough explicit information in the presentation. If you feel like downloading it, you can. I was worried because this presentation and a lot of the ones that you're hearing, they relate to articles that we wrote for the topics in language, and that's by subscription. And I didn't want to be in a position of people not being able to use this, having to pay for it. So what Sue Grogan Johnson was very kind and agreed that I could post the STA on an open source, website. And so it'll always be there. You'll never have to ask me permission to use it, and I'll be updating it also. So here are the components of the STA. There's at least 60 aspirational questions, and I could say they're aspirational. Some are things to aim for, some are, as you heard from Erin last week, obligatory. You don't want to violate federal law. So the first group is compliance with federal legislation. The second has to do with personnel policies, and some of those overlap with the third category, roles and responsibilities of school-based SLPs, which is really the interesting part in terms of being comparable. And then we talk about privacy and security. So why was it designed? It was designed because, I kept seeing things like advertisements. Would you like to do an hour of therapy, teletherapy? And there was nothing, didn't have a sense that these folks were interacting with the school, with IEPs, with other school people. They certainly weren't going to get paid for it. And also, this is such a big audience. 50% of our field are employed in the schools, and school-based SLPs really embrace telepractice as something they could do in the summers, on the side. And So that's why the demographics were there for the STA. And also, a lot of you were thrust into telepractice because of the pandemic without training. And companies were some companies were better than others in terms of training. Obviously, Illuma is providing a lot of ongoing training, which I really admire. But the same thing happened for any of you teaching at the university level. People left work on Friday, and then on Monday they were told, don't come back to the office and be online with your teaching. And they didn't know how to do it. And so it seemed like the STA was really important in terms of setting up expectations for what should happen for school-based teletherapy. Some of you are probably already engaged in telepractice. You might be in a solo private practice. You might be employed by a telepractice company by Illuma. And so, this is probably a mixed audience that I'm talking to right now. And I hope that all of you can find something of use in this presentation. So I think what really motivated me and Erin was that ASHA requires comparable services. They keep saying that, and research articles say, oh yes, this proves there's comparability. This was talked about in 2010, and other especially state boards are pushing for this, and other disciplines as well. So it made me want to think, what constitutes comparable services? Can these services be comparable? Do they really need to be comparable? And how can comparability be assessed? So it really all hinges on the definition of comparability, which isn't well defined in the literature. So again, how to use the STA? Well, it's open source, which means it's free. Okay, and there's no copy for this. There's no copyright issues. You just have to cite it where it came from. It is a diagnostic audit tool. This is where we are. Okay, I think it can help you figure out where things are at this point. It has aspirational elements, which I think are important in any tool like this. This is what we need. Okay, and this might help you get what you need with a company or a school district or a supervisor. It's not standardized. It hasn't been research, hasn't been applied to this. You can adapt it as you wish. I don't care if you change elements, if you add to them, if you subtract to them, whatever you want to do with it, however it's useful. Just give some attribution to the original source, the described from University of Pittsburgh source. Use what makes sense for you. It's pretty long, and not everything's going to, apply. It's not meant, this is really important, it's not meant to offer pass-fail or a performance evaluation. That should not be used for performance evaluations, okay? Especially because the elements are not necessarily weighted the same. So if you violate, if not saying you, but if one of us violates federal law, that's pretty significant. But if there's something else we fail to do, well, that may not be as important. So the elements are not necessarily weighted the same. And that would be an interesting area for future research to think about what are the perceptions of what are the most important elements. So this can inform best practices for telepractice, and there aren't a lot, that are published. I want to say that the ASHA website on professional issues is a really good compilation of resources for you. But generally, the knowledge of telepractice is uneven. It's not being taught in universities. Little more and more, you'll hear Jonine, who's doing some of that teaching really well, but in general, it's not part of the praxis exam. We don't often are even allowed to do practicum unless there's certain circumstances. And so the knowledge is uneven. And so I think this measure, this tool says, what do I know to be able to engage in telepractice? It's kind of self-assessment. And then it's, what do I need to know? And that's really important. A lot of people know a lot, but they realize they need to know more. I need to always know more. And this is exhibiting telepractice humility. Kind of, you heard of cultural humility? Well, I think that, knowing all the stuff we need to about telepractice is humbling. So now the STA can also inform best practices for school-based practice. And I want to be real clear. I'm not a school-based therapist. I had a practicum as an undergraduate, which I don't always recommend having practicum in that way, being thrown into a school, but I actually loved it. And so I'm not an expert, and that was a long time ago. And that's why Erin came in. And also I watched a lot of ASHA CE. There's some great CE about school-based practice and legislation. So now school-based knowledge is uneven across the profession. And those of you working in the area, I'm sure that you know people who are just saying, oh, I think I'll just do this school-based stuff part-time. And they really don't know all the things that you know. And so it's important. This tool is really to unearth, to show people what is it you really need to know to do this well. So first it tells you, what do I know? And then what do I need to know? And a lot of people, realize they need to know more, and they exhibit school-based practice humility. Okay, humility is always a good thing in our profession. And we, there's some great ways to learn more about both of these areas. So now, what's required to support legal, safe, and competent school-based telepractice? Well, there needs to be a culture of collaboration between the practitioner and the school and the company, and parents and the client. It certainly you need to satisfy legal imperatives. And, I think some people think, well, I'm immune to this because I only go in there 3 hours a week, but you still have to satisfy those legal imperatives. And I guess there's a difference in terms of whether you're in a cyber school or, you're working with a school that was brick and mortar, but those imperatives should be the same for both. I guess some places get around it by just asking for therapists after school. I've gotten a lot of those requests, but generally we should be satisfying those legal imperatives that Erin talked about. We need a good technology infrastructure. And that really depends on you all and me having it at home, and also having support from the school and the company. And a big one is time, having enough time. We need reasonable productivity requirements. And maybe after listening to me today and listening to Erin, you'll realize, I really need more time in order to satisfy all of those legal requirements and collaboration requirements. And you know what? It would be good if it was salaried time. Okay, unless you're with a generous company that is paying you for all of your contacts relative to this kind of practice, it's a good thing if there's some kind of an agreement that you will get paid for those other collaborations and interactions you need to have. So now the STA can also inform related audiences. Special ed, some of you may be special ed directors here, which is great. Occupational therapy, physical therapy, literacy is a big one in schools, and psychology. So, it can inform them as to what we do and how we interact with them, but also some of this applies to them. And so school administrators, it's useful if they understand what the territory is, what our expectations must be, school districts, contracted providers, and also university training. Our students need to go out and be prepared, and our alumni need to be retooled in many cases. So now, I am humbled because the knowledge required for school-based telepractice is really complex and specialized. Some people say, oh, I'm tired of this other practice, I'll just go to the schools. I think this is very, very rigorous and specialized. And so here's the things we have to know. We have to clinical expertise, assessment, and therapy. Okay, just basic, how to work with children, how to work with different disorders, how to assess them. There's a lot of legal stuff we need to know. If we just say, oh, the company will take care of that, well, that's not enough. If something goes wrong, if something isn't abided by, we are also, responsible. So there are federal, state, and as Erin talked about, district requirements that are very specific for school-based practice, and we have to know all of those. we have to understand how the school functions. What's the culture of the school? How does it function? How do people relate to one another? One of the joyful things I found in being in a school, even in person, was that terrific culture, and being able to maintain that online is really important. And then there's the whole issue of telepractice. How do we do that? There's a lot of best practices we need to know, and you've heard some really good foundational talk about that already. So I want to talk about the fact that ethics, tele-ethics, is a unifying thread for all of this, for school-based work and telepractice work. And the ASHA Code of Ethics is just wonderful. And if you kind of extract it into like this, the most foundational parts, you can look at it as a triad. We have to practice in a lawful manner. We have to employ ethical communication with everyone. And we have to, most importantly, uphold the well-being of the client. So yeah, we got ethics. And so here's some of the ethical questions, a quick test for people doing telepractice. One is there evidence? And evidence could be either research or your experience or the experience of others. The telepractice can be equally effective as in-person practice for your client. Now, some of the research is showing that it's more effective. And of course, it depends on the particular disorder, and every client's different. Might your client be better served by a hybrid approach? That means in-person plus telepractice. So my friend, Dr. Karen Golding-Kushner, she has a private practice in cleft palate only. She specializes in that in New Jersey, but she telepractices even all over the world. And there's sometimes when she'll say, I really can't hear everything online. I need to see this person in person. And at that point, she will, especially for local people, she'll really make sure that she has some in-person exposure. We like the word in-person instead of face-to-face, because what we're doing now, in a way, if I could see your face and you see my face, that's face-to-face, but in-person means in the actual place. So now we also need to know, in terms of ethics, we don't practice unless we are knowledgeable enough, right? And we need to know is our knowledge of telepractice sufficient? We have to know all these things: safety, privacy, technology, and telepresence, how to keep someone interested in what you're doing. And then finally, is your knowledge about a client's disorder sufficient to practice, I love this term, at the top of your license? Or would it be best to serve the client by referring them to another clinician or a specialized team? So in my case, I never saw a client with cleft palate by myself. I felt that, cleft work is team-based, and I always was engaging a team, make sure they had been to a team and work with the team, never by myself. So here's a source for some of the ethics stuff. Now, I love the, actually, let me go back here, sort of jump down on conversion, but we can still see it. The Texas Instrument Company has this ethics quick test. They put it on a card and everyone gets it, and everyone, they refer to it. So here's their test, and I think it applies to what we do. Is the action legal? Okay. Does it comply with our values? If you do it, will you feel bad? We usually know if we've done something we're not supposed to, or we're thinking about it. We don't feel just right about it. And if you just think about how will it look in the newspaper or in the ASHA leader when we're called out by the ASHA Ethics Committee, how's it going to look? We don't want, think about that. If you know it's wrong, just don't do it. Okay. And if you're working someplace where they're asking you to do the stuff that's wrong, it's probably not the best place to be. If you're not sure, ask. And there's something else on the bottom. But I think that had to do with if you're, just keep asking until you get the right answer. And it was interesting today, today is Colin Powell's funeral. And they were talking about, before I started this, about how he really helped a lot of people know what to do, what's the right thing to do. And he said, well, yeah, I've done that, but, how do you feel about that? He would ask some of the same questions. Okay, so part one of the STA was just beautifully presented by Erin Lundblom. And she talked about compliance with telepractice delivery in the schools with federal legislation. She talked about the IDA, Title II of the ADA, Section 404 of the Rehab Act. And she's really nuanced and great. I recommend if you listen to that, even if you're experienced. So now, as in my part, I'm going to present some telepractice content, but not the basic foundational stuff like how do you light properly and how do you adapt materials for the screen. My job is more to talk about what's in the STA part 2. So we'll talk about personnel policies, a little bit of overlap with that, and roles and responsibilities of school-based SLPs. And then we'll talk about privacy and security. So this is like the kinds of elements that we should be auditing. Personnel policies will be first. Now, I'll just, I'm not gonna go in detail, obviously, over all these questions, but I'll skirt over them. SLP personnel have to meet all state requirements, okay? And that's really important. If you're in one state, you gotta learn what's going on in the other states. So there's a lot of different requirements: state licensure, educational certification. Now, ASHA is working on a compact, which means that one of our a license from a certain state will transfer to other states, but I think there's about 15 states right now, and it's the details aren't worked out. Is this covered by malpractice insurance? Be sure you have your malpractice insurance, and be sure that the company will cover you. So like you might say, why do I have to do that? Well, let's say you're working with someone and they fall off the chair, okay? And you could, be potentially sued for something unsafe that happens in their environment. You don't want to be in that position. Not to say you'd be to blame, but you always have to have malpractice insurance. And so you have to be in good standing with ASHA. And you also have to have the right state licensure, because malpractice insurance won't cover you if you're practicing in a state and you don't have state certification in that state. These insurance companies, they want to avoid all liability and all payments. So you have to be sure that you really gotten the state licensure under control. You have to have, of course, those training and experience, the knowledge and the skills. We're responsible for support personnel for our speech language pathology assistants. Are they trained well enough to support telepractice? How do we supervise them? And is there a plan in place to supervise the actual telepractice SLPs? So some companies will watch people. There's different ways of supervising. Is there on-site support in the school, okay, to support telepractice? Is there someone you can call, if things go wrong with the technical stuff? It's going to happen, and there needs to be someone you can call. If, let's say that you're operating from a distance, that the child's in the school, who's going to escort the child to and from the telesession? Who's going to stay with the child or monitor that they're safe? So that would be providing support. Is there a plan to have ongoing contact with all of these other stakeholders, parents, teachers, to be certain the therapy is relevant to a student's academic and home environments? Now, Erin made the case that therapy that's done in the schools has to really relate to the educational objectives that they're trying to work with the child on. So how are we going to do that? That takes some time. How do we learn what the curriculum is like? How do we make sure we have contact with the teacher and ongoing contact? Then moving on to Q11, is there a policy concerning caseload amounts for telepractice? They surely shouldn't be more than what's happening in the school in person. What about session length? What is required in the school? Is there a policy concerning student to practitioner ratio? Are you responsible for screening? How does it work in terms of referrals? How do these students come to you? Is there a maximum group size in a telepractice therapy session? You know, that could be even more difficult to manage if you're not very skilled than in person. So, you know, group work in telepractice takes a fair amount of skill, but of course it's useful because there's some peer interaction. And of course, there's the question, should all the disorders in the group be the same or different? Which I'm not going to approach at this point, but also, what's the approximate minimum active individual therapy time per client per session? Okay, and that would apply to group work. So now, if that wasn't enough, we're going to go into roles and responsibilities of SLPs in the schools. There's a lot we have to do here in the schools. So now, is an audit question, are the services offered across all grade levels, including early intervention? And I really hope that this extends to high school. A lot of kids really develop more difficulties in high school in terms of voice and fluency and you know, other conditions. So I've always been in favor of looking at the kids in high school and junior high. So are the services offered for a range of disorders, the same as would be in a school? You might be working with swallowing and you know, literacy and you know, elective mutism potentially. Can these services be offered for a range? Q3, this is really big, or you won't get paid. The school won't get paid, and it's against the law. Does speech and language services have educational relevance? Okay, that's a really big one. And I thought Aaron really talked really well about that and talked about different ways of assessing educational relevance in terms of an effect on how they're achieving on the curriculum, looking at standard tests, looking at how they're getting along with peers at school. Q4 is, do the speech and language services offer, it's a little typo there, sorry. No, it's not a typo. Do the speech and language services offered via telepractice provide unique contributions to the curriculum? I think that's always been a strength in terms of being in the school, having collaboration with the teachers and exchanging as respectful peers to each other, unique information that you know, enriches their curriculum and enriches our therapy. Does Q5, do the language services highlight language and literacy? And if there are literacy specialists, are you all working together? Q6, do the services provide culturally competent services? And that's a really huge one, of course, right now. And you know, I think we're learning more and more about that. And I want to mention that sometimes, you know, if kids are working at home and they're of lower socioeconomic level, they may be embarrassed in terms of what's going on in their environments. They may not want to be on screen. So I found that at the university level for sure. Q7 is, does a school SLP telepractitioner exercise a role in prevention? Now, that's been some of the justification for co-teaching, where you know, the SLP is introducing concepts, phonetics and you know, speech improvement kinds of activities that may prevent some issues. Maybe it's voice, vocal hygiene. Do we still have a role in prevention in telepractice? And if not, does that mean it's comparable? Q8, assessment. Can we engage in assessment? And as Aaron pointed out last week, assessment is really obligatory in terms of IEP. Are we engaging in educational program design? A lot of times in schools, SLPs are actually working with curriculum committees, and they are, you know, there's a team working on the program and curricula. And is the SLP practitioner gathering data and an analysis and compliance? You know, it's important to keep data in terms of how kids are improving and the number of served and the time involved and all of that. Q11 is huge. Are we placing a high priority on collaboration? to meet the student needs. It's not, you know, just something that's small, it's huge, and we need to have the time to engage in it. And then Q12 is, you know, will the SLP practitioner, telepractitioner become engaged in the school and after school activities as part of the larger school community? Now, people have complained, I don't want to do bus duty, I don't want to be in the lunchroom, all those things, and there's valid complaints for that, you know, professionals with training. But on the other hand, that provides opportunities to appear part of the team and also to observe children in naturalistic environments. So I think that's a valuable activity. And how does that happen online? So that relates to Q13. How do we interact with students outside of the therapy room or the classroom to assess progress and promote generalization? Now, the issue of working in the classroom is something that's been controversial because on this, you know, we don't necessarily have permission to show other students on the screen, to video them. But on, you know, in order to promote generalization, make this educationally relevant, it's very useful to see how children are interacting in the classroom. There's some kind of cool robots that I think they're about $10,000 each that can be in a classroom for a child that is very ill and be part of the class. And you know, I can see where the therapist can, you know, remotely roll themselves around the school to be part of a class. Now let's move into, let's see my time, we're doing pretty well. Privacy, security, and safety policies. A lot of these are really obligatory, okay? So number one, does the telepractice provider have, that's a vendor like Zoom or whatever your school uses, do they have privacy policies in place? This is really important. And do they meet federal and state guidelines? Now, there's something called the BAA. Some of you may have heard of that. It's called the Business Associate Agreement. It's this legal agreement between the telehealth system vendor, okay, and the school or the contractor. Some of the companies refuse to do this, but it's really important. It shows you how to get a sample of BAA and adapt it for your purposes. Now, I would assume if you're working for a company, the company's done that. Why is this important? Well, if there's a breach, a privacy breach, the BAA states that the, you know, who is to notify the students and the parents, especially, that a breach has occurred. And it's a really important element to have if you're working solo. So now, is the environment sufficiently private when recordings occur? And those are kind of both environments. If someone comes in here and they're over my shoulder and they're watching me work with a client, that's not private for the client. That person doesn't have clearances necessarily. It's like a family member. Pets don't count. We see a lot of pets on telepractice, but you know, and also in this, when we're capturing the child, are we capturing other children in the family that we don't have clearances for, and they're being recorded by the company? You know, these companies are, you know, they're not just broadcasting the data, they're usually recording them to some degree. And how are they preventing the unauthorized viewing of telepractice sessions or data? So privacy is really, really huge. So now we talked about storage. How are these recordings stored? Who stores them? For how long? Is it possible they could be sold to Europe, you know, or other countries where they don't have laws as rigorous as in the United States? How long are they keeping the content? We hope not long at all. What about protected health information? You're interviewing a family about the child's health. How is that securely stored? What happens if the device is lost? Okay, it happens a lot where a laptop is lost and a lot of information's on there. Can you remotely erase that if it's lost or stolen? Encryption. Everything has to be encrypted. Okay, email. You know, if you're using a fax machine, does the encryption meet federal and state standards? Look at all those standards: HIPAA, high-tech, ISO, NIST. There's a lot of standards, and it's good if a company, if your tech people are helping you or on your team to help you with this. What data are encrypted? Are encryption keys regularly updated? So these keys and the passwords have to be changed. You know, if you're doing telepractice and you're using a phone for it, that phone that's connected, let's say, to some of the technology, the servers, that shouldn't be used for personal calls. It should only be used for telepractice. And you know, data can be stolen from a server when it's at rest. So it's really a big deal in terms of encryption. Backup, okay, that happens a lot. It's going to happen. And if equipment fails, how do you get the equipment? How do you get the data? Especially if there's a video conferencing fails, is there a backup plan to resume communication? That's why the family, the teacher, wherever it is, they should have your phone number, you should have their phone number. And then there should be authentication and access control for PHI disclosures. And the networks, we have to use secure networks, okay? So we can't like sit in Starbucks and use their network. I never use networks like a university network in a hotel on their Wi-Fi. I don't trust it even if I pay for it. And there's something called an audit trail sometimes to gain to learn who's gaining access to the PHI, protected health information. Well, you know what? When there's an audit system in place and something goes wrong and the company hasn't been checking the audits, they're even more liable. So audits are good, but they can, you know, they have to really be tended to. And then, is there antivirus and anti-malware programs installed on all devices used for telepractice sessions? Your devices, the client's devices, who's paying for that, who's doing that? And then there's safety. This is a really big one. If how do we know? Let's say a client appears to be having a stroke, probably not in the school system, but you know, I'm with an older client. Who do we call if they're not in a place? You know, if we don't know the emergency numbers for that locality, we don't know who to call to be helpful. Who's in the house with them? Who's in the institution with them? If you call 911, you get your local 911. You don't get the one in another state. So, and don't assume that the client is always in the same place. You have to always check, where are you, who's there, and have that information. And then, is there a policy concerning how students are escorted to and from a session? When is the session over? My friends in the VA tell me it's over when the client leaves the room. They feel responsible for the client's safety through the whole session. And then there's the consent evaluations. And yes, you have to have informed consent, and it has to contain a certain elements like privacy and security and vulnerabilities. And is there a mechanism for people to provide feedback about a telesession or a telepractice program? You know, it's really important. Where do they complain to? And some companies, you can't even tell who owns the company. And so, you know, you have to be sure that there is really a reliable place for feedback. What happens if the family doesn't want to continue telepractice? Well, they need to be informed ahead of time that what will happen, and services should somehow be substituted. Is there a plan for annual program evaluation? Okay, all this stuff I'm going over, it's of no use if it's not evaluated routinely. And how about stakeholder satisfaction? And you know, it's not just teachers and family and the clinician, but the clients. You know, a lot of students have a lot of opinions about the services they get. So now, just check, we're doing okay on time. What now? What questions does this bring up? So we know that telepractice provides benefits, right? We've been hearing that it saves time for the family, time for the therapist, and travel, and those costs involved. And we've been we've been reading that the therapeutic results are the same. It's often per context, different disorders, different severities. We still need a lot more research. And what does it mean to have comparability? Okay, we'll talk about that some more as we move ahead. What's the time to achieve results? So yeah, there's some really wonderful literature coming up, but I have to say, as a journal editor, I don't get many studies that provide negative results. They always provide positive results, and it all can't be positive, right? You know, it's not always going to be positive. So I think we're really at the beginning of gathering this research. So now do we need to ask different questions in order to say, well, yeah, it's comparable? Does time in therapy have to be comparable? If we see a student less, then if it would be in person, is that comparable? You know, and get the same results. What about diagnostic time? Is it the same? What's the ratio of time? What's the ratio of time to complete the IEP process? Is it more cumbersome to do it virtually? Do you have to have the same therapy goals and measurable outcomes? Do they have to be comparable? They may be better on telepractice because you may be using more of the natural environment. Do the therapy methods have to be comparable? Okay, I'm not sure they need to be. But again, the issue of, you know, it must be comparable is really a big one. And I think states really haven't understood that very well. And they've, you know, demanded certain kinds of processes that are the same exact ones as for in-person. And then this is one for the future. What about artificial intelligence? That is going to be huge. I saw some research recently about fluency and how there's some companies that are developing programs that barely use an SLP, and they're getting some pretty good results. So, you know, how do we relate to that? How do we make sure that there's that caring element and be sure that we see the more complicated cases? So artificial intelligence in Europe is really being looked at, as is gaming. Are there curricular benefits to this? And we talked about, do we know about the curriculum? You know, how many of you know about what's going on exactly with the curriculum and in the classroom? And who initiates this co-teaching? And how much time is spent, and what are the outcomes, and can it really be preventative? So we have some questions about this. I've always loved that this is possible in the school, but maybe it's not needed to be, you know, the same. So now, you know, how do we look at these therapeutic outcomes? Well, we can, as Aaron talked last week, we can look at standardized outcome measures from testing. I think it's important to look at self-concept and the impact of these communication differences. And I know fluency, folks doing fluency work have tools for that. What's the generalization outside of the therapy room, and how do we measure that? We're not so good at that yet. You know, how's the student communicating with family members and peers and teachers? And then finally, what about this caring part? What's the perception of clinician caring? To me, that's a really important thing. And then what's the time allocation that we're spending? You know, time spent with a student, time spent with the teachers or staff, time spent in the IEP. If we don't have a handle on this, you know, we're going to do a lot of extra stuff and not get reimbursed. And it's not going to be fair to the company or the district or the school. So we really have to have a better sense of what the time requirements are. And then the hybrid practice. When should it be used? Who starts it? Does the employer support it? Does it cost more? And so what's the ratio of in-person to hybrid care? And how does this vary for disorders and for severity types? And then sometimes there's denial or termination of telepractice. Why does this occur? It's not written about a lot. When does it happen? And then is in-person treatment feasible? So you see the issue of being comparable has a lot of different elements to it. And then what's the impact of telepractice on the professional? Okay, is it a good thing? Is it negative? Is it mixed? Is there no impact? Are you more stressed doing this or less stressed? So what about the training? What's the gold standard? How much training do you need? Is there mentorship in the actual telepractice environment? I've had that for distance education, very helpful to have someone really experienced in my beginning classrooms and learning from them. And I think that should happen for telepractice. Are the salary and benefits comparable? A lot of times they're not at all. And, you know, it's kind of, it's really trading sometimes, you know, convenience and not traveling for that. And I understand that, but it's important to think about it. Does the SLP have to pay for their equipment and connectivity? That's an issue of infrastructure invested by the telecompanies. And or maybe there's a stipend for that, or maybe you can deduct it from your taxes. And then what's the time spent per unit of function? What's productivity? And is that looked at for just the therapy services, or IEP work and collaboration and socialization? The technical side of it. Let's say you're struggling with the technology for 2 hours. You know, is that free? What about e-helper training and supervision? That takes time. And then we've got the therapy. So, you know, you could see that this creates many more demands on the professional. And I don't think, you know, yeah, we're doing surveys, you know, do you like it? Do you want to use it? But in terms of the actual impact, I don't think we've got a lot of data yet. Now, this relates to the issue of cultural sensitivity. How does it work for students whose families are economically challenged? And this is why we initially were interested in telepractice. We can reach people who couldn't be reached otherwise. And excuse me, is the necessary professional effort comparable? Is the family satisfaction comparable? What about the cultural factors? And you know, in some school districts, there's like 40 or 80 different cultures. Are you learning about that and relating that to the practice? And are the therapeutic results comparable? So we have to ask the question below, does telepractice level the training field or the playing field? So all of you who are engaging in this, you're creative beings, I'm sure. You are adapting to a lack of physical presence in the school. You're figuring out ways to connect with school people and parents, and you're establishing those relationships. You're figuring out ways to observe the child in non-therapy interactions, okay? You're creating engaging materials and techniques for telepractice that, you know, that's like 8 hours worth of tutorials. There's some great stuff on the ASHA website on that, and the CE programs. If you buy that annual pass, there's some great ones, especially out of Waldo General Hospital in Maine. And you have to learn how to manage small groups, okay, and keep them interested. So it's really important to love telepractice, okay, and you may not love it, and if you don't love it, don't do it. But those people who love it, and not just because, you know, they can practice in their pajamas or whatever, but who love the technology and the interaction and the creativity, those are people that should be doing it. And if you don't love it, you know, I don't think anything less of you. It's better to do other things. So obviously, those of you watching this, you should probably love it. So I thank you, and I know there's time for questions. I know there's some other announcements that George wants to make. George, do you want to make them before we do questions, or?
We'll get the questions, and then we'll go to the announcements after. We'll talk about next week's webinar, and we're going to announce a couple of winners for our little promotion contest today. But yeah, let's jump to the questions. We've got several here. I don't know that we'll have time to hit all of them, but the first one is from Linda Lafiatis. I've been wondering about giving standardized evaluations and if you think they can be used in telepractice since the standardization was done with in-person clients.
Well, that's a really good question. And Pearson was doing a lot of research about that. And the last I heard was that they stopped some of that research, feeling that it was comparable. So yes, I believe you can do, and you're required to do that. And I think it's best if you're using tools that have been adapted to online use. So my answer is a yes to that.
Okay, and the next question there, you know, and it kind of ties into this, but it's more along the lines of the research. You indicated that it was mostly positive, and that I wanted to ask if there are studies that have more negative findings, and you know, if there are, you know, what are you reading into those, and you know, what do you make of the research that's being done on teletherapy outcomes right now?
Well, I think it's sparse. I think I've only published in all those years since 2008 about one study that has negative results, and I really and sometimes it'll look positive in the abstract, but then they'll talk about the limitations, and you'll see some negative results in there. I just think that we're not drilling down and asking some of the nuanced questions that I presented here. And so, yeah, the questions are usually, you know, are the results the same on some test? Is it saving money? Is it saving time? But I think that we need to ask more nuanced questions, as I'm hoping that you felt that they were in the STA. So yeah, the research is really young. There's not a lot of money for this research. There was finally a grant from NIH that's looking at differences in telepractice for kids with cleft palate. I haven't read that. Cleft palate usually needs to be repaired surgically. And then there's other, you know, maybe for certain kinds of articulation issues that don't require velopharyngeal closure, you know, therapy is worthwhile. But, you know, I think that the research is just nascent.
Okay, I think that's fair. You know, with the body of research that's out there, and again, we have some of the leading researchers as part of this series, yourself included, people like Jonine Lohman, Sue Grogan-Johnson. You know, they've done a lot to move outcome research forward, and so we're excited to have them as guests. But I'd love to get, you know, kind of your hot take, you know, with regards to outcomes. What's your general sense? You know, how does the nascent teletherapy for speech stack up against the in-person therapy?
I think it appears comparable in terms of outcomes. Now, again, what outcomes are being looked at, and is it nuanced? Are they looking at outcomes that really apply to general, you know, in life? Are they generalized? Are they, you know, it's really important to look at outcomes. Do they make the person feel different about their communication? So I think that the outcomes are looking good. The issue I have is, are they looking at the full range of outcomes? And that takes a lot of money, and there's not a lot of money right now in this research. I mean, this research is barely funded. And I don't recommend that you say, oh, I think I'm going to get a PhD and specialize in telepractice, unless you're working with Jonine and University of Kentucky. But in general, you know, there aren't jobs that are hiring researchers in telepractice, because, you know, universities want people to bring in grant money, right? And there's not a lot of grant money in this right now. And as long as no one's asking the questions or caring about it, you know, just looks positive, good, let's keep doing it. I don't think the research is going to greatly expand.
I think, you know, one thing that might shift that a little bit is just the idea of not just the persistent shortages of clinicians, but also the growing shortages. I mean, it's you know, right now every year is another drop in the bucket, so it's not growing at any rapid, alarming pace. But the shortages are already pervasive, and they're already problematic across the country. And so each additional drop in the bucket over time creates more problems. So it'd be interesting to see. We have another question here, and it's perhaps our last one, from Penelope Ferris. Hi, Ellen. Any suggestions to observe students outside of speech time?
Well, that takes some creativity. And I think a lot of times students are recording themselves on iPhones, and you can, I've seen really nice videos where the student is walking through the zoo with their iPhone and they're recording themselves, and they're having it in, Nathan Cornish has done a lot of work with that. So that's a way to look at it. Of course, there's parental reports, but I think anytime you can somehow wheel your webcam into a room and classroom or whatever and just watch the student and not violate confidentiality, that's a good thing. So those are some suggestions. I know it's difficult, but those are I think that's an issue of comparability. Okay.
Well, that's awesome. Well, we have actually several more questions here, but we just don't have time to take them on. But I think that your last answer to your question was a perfect segue to introduce our next week's webinar, and that is with Jonine Lohman. The title of the webinar is Maximizing and Sustaining School-Based Telepractice Services, a panel discussion. So it's going to be a little bit of a different kind of webinar. As you mentioned, Ellen, Jonine is one of the biggest names in teletherapy outcome research. She's at the University of Kentucky, and she's going to be conducting a panel interview with a couple of special education directors who use teletherapy, as well as a couple of telepractitioners. So I'm really interested to see how that goes. It's going to be a very interesting discussion. So we invite you to all come to that. And then last but not least, let's go to the last slide. We had mentioned that we had that we were going to give out special prizes to people who liked us on either Facebook or Twitter. We have two winners. The prize is they're going to get passes to Illumination and access to all of the recordings. It's a $20 value. We'd be given free of charge. And in addition, they will be getting a $10 Starbucks gift card. We have two winners today, Wendy Jorgensen and Marva Mount. So those are our two winners. Please come back next week. We're going to have this cool webinar with Jonine. But in the meantime, wanted to thank you so much, Ellen, for coming back and joining us once again. We hope that you will be coming again in the future, but in the meantime, wanted to let you know this was a wonderful presentation.
Oh, my pleasure. Thank you so much, George, and all of you. I hope you have a really great weekend.
Yes, to everyone who joined us, have a fantastic weekend. Stay healthy.
Yeah.